Hello, and welcome to Grade.com Talks With. Today, we're talking with Shailene Stanley, Next Generation Engagement Officer at Pathfinder International, an organization that is driven by the conviction that all people, regardless of where they live, have the right to decide whether and when to have children, to exist free from fear and stigma, and to lead the lives they choose. And if you're new to our podcast, please press subscribe button either on YouTube or your podcast app, because today we're going to learn about an organization that envisions a world where everyone has access to contraception, where there are zero new HIV infections, where no woman dies from preventable pregnancy-related complications, and where everyone leads a healthy sexual and reproductive life. Hello, Shailene. Welcome to Grade.com Talks. We're excited to have you here.
Thanks. It's great to be here.
Wonderful. How would you describe Pathfinder International for someone who is not familiar with your work?
Sure. So Pathfinder International is an international organization that focuses specifically on working in communities around the world to improve their ability to access the information that they need related to their sexual and reproductive health, and then also enable them to be able to make the decision that they want about their health for their future. So we work largely, we're not a service delivery organization, but rather we work with existing systems like your clinics and your health systems to improve their capacity to provide the services and education to their communities that they need.
Mm-hmm. I really like the fact that you are helping existing organizations, whether it's a clinic, a hospital, or just a place where people can gather information regarding their sexual and reproductive health. And you are working with them to enhance the quality of work that they do, as well as to increase awareness about the rights, so each and individual person across the world knows what their rights are, and they are practicing those rights. Could you please describe, you mentioned in your vision and mission statements, it includes that you want that everyone to lead a healthy and sexual reproductive life. What does healthy sexual and reproductive life represents, and what kind of rights does it include?
Yeah, no, that's a great question, because it can mean a lot of different things. And there are a lot of different specific issues and ways of working that fall under sexual and reproductive health. So for Pathfinder, a lot of our work really revolves around making sure that individuals have access to contraception and family planning services. But that also means working a lot with adolescents and youth. That means sometimes working on specific issues like cervical cancer we've worked on in the past, HIV. We also do some work around safe post-abortion care, focusing on maternal health and newborn health and care. And then we also do quite a bit of advocacy work. And that's what really starts to tap into that rights area, is making sure not only that we're providing more opportunities for existing health systems to really improve their ability to work, but also then that the communities that they're trying to reach have written into law access to these services too. So really breaking down any barrier that might prevent an individual from reaching the information or the services that they need.
Mm-hmm. So that spectrum of your work includes quite a range of health-related issues. You mentioned about safe abortion care. You mentioned about contraceptions, working with HIV, and working on the health of mothers and the children. And you mentioned that at this moment, there are barriers that preventing people from getting those essential services. Could you please describe some of those barriers for us?
Yeah, absolutely. I think one of the biggest barriers is just access to information, especially for sexual and reproductive health, even in very developed communities, even in my own community in the United States, it can be a very taboo topic to discuss. And if you're thinking about some of the most remote communities across the world, Pathfinder currently works in about 20 countries. Some of those really hard to reach communities, if I'm having trouble accessing the information that I need sometimes, or feel that during changing political climates, the services that I have access to may shift, having that level of understanding, if you're in a community that's that hard to reach, is even greater. And just starting the conversation about what it means to have protected sex, or what it means when you start menstruating for a young female. Having those conversations are still very taboo in a lot of areas around the world and even here. And so really breaking down, just getting those individuals information about what it means to be healthy, what's normal, how to care for yourself and have proper hygiene when you're menstruating. Those are all conversations that are some of the most foundational conversations that I may have once taken for granted, but that a lot of individuals really need that information so that they're really able to look after themselves and stay healthy, essentially.
I really like the comparison that you made. Even in developed world like United States and the area that you live in, it's still there is a lack of information on the proper health related issue when it comes to sexual and reproductive health. And when it comes, if it's in developed world, there is still misinformation. Then in the underdeveloped and developing world, the extent of it is even higher. And you mentioned that it is taboo. Yes, I can ensure that it's taboo. I grew up in a developing country in Tajikistan, and we didn't have sexual health course at school, and so no one really knew. And I can imagine the pain that misinformation might cause the young and adolescent girls when it comes to menstruating, and having the proper information as well as having a proper access to information is very, very important. And the fact that you are breaking that barrier and building a bridge between the people who need the information as well as the current system that is providing that information is very, very important. There are 214 million women that don't have a choice about the pregnancy, and your organization and programs are changing it. Could you please describe how is that change is happening?
Sure, absolutely. One of the key things, and one of my favorite things about Pathfinder, is their ability to really partner with community health extension workers. So if you think about a lot of times, especially if you're in a developed country, if I say I were to become pregnant, I know that I can reach out to my primary healthcare provider and she'll refer me to the gynecologist that I need, or I know that I need to go to a gynecologist. I kind of know the system that's in place and where I need to go to get the information that I need to take care of myself. But if you have someone that maybe lives miles from the nearest clinic and isn't sure that maybe, like, do I go to the clinic or do I need to go to the hospital? Where is the right doctor? Having those kinds of conversations are a lot more challenging to access. And Pathfinder partners with community health workers who go out into the communities and really are able to be that middleman between the clinic and between the communities that need that kind of information and that kind of care. So we'll work with our community health workers to make sure that they have the information that they need to really counsel pregnant mothers throughout their pregnancy, to make sure that they know when they need to seek additional care, when they need to visit a clinic throughout their pregnancy, and really make sure that they have the information that they need to carry out a really healthy pregnancy. So really leveraging that community expertise and that community understanding also of the culture, the taboos, the different ways that they communicate about these issues is really critical to make sure that those pregnant women have the care and information that they need specifically for their time during pregnancy.
Mm-hmm. Yeah, I can imagine if someone is living in the remote area, there are no clinics. There might be no clinics nearby. There might not be hospitals nearby. And the fact that community health workers can come to those pregnant and women that are looking for help about the information about how the proper pregnancy should look like, what kind of implications does it include, and how to properly take care of themselves. And having community health workers there to support them is very important, because those are trusted, usually community health workers are trusted people that have some reputation within the community, and then can be someone people can rely on when it comes to health related issues. And that's very, very important. you also mentioned that you are fighting towards safe abortion care. Could you please tell us more about your efforts in this field as well?
Yeah, absolutely. So unsafe abortions is one of the leading causes of death for young women under the age of 18. And a lot of times it's simply because they don't have access to the care it really is because they don't have access to the care that they need to take care of themselves in these situations. And it can go into so many different ways, right? Like first it was then if a woman seeks to have an abortion, perhaps she just didn't want to have a pregnancy to begin with. And so we work to really ensure that young people have access to the contraception that they need so they're able to decide when they want to have children. But then even those that seek an abortion, a lot of times do so in unsafe ways, whether it's because it's not legal in the country or community that they're in, or that the care is too far, or that it's an accidental abortion, perhaps they're having a miscarriage. These are all reasons that can really be harmful to the woman who is pregnant, and especially for younger women, this can be extremely life-threatening. So Pathfinder really works with communities to make sure, and clinics to make sure that they have the resources, those clinics and those healthcare providers have the resources that they need to really make sure that after a woman has an abortion, that she's able to access specific services and get the medicine that she needs to really make sure that she's taken care of in a healthy way. So it's really focusing on, we try to ensure that these women have, and communities have, the contraception that they need so that they're being intentional about their pregnancy. But then even if an abortion does happen, that communities and clinics are ready to take those women in and provide them the care that they need so that they won't have a life-threatening circumstance.
Mm-hmm. It's very sad that unsafe abortion is one of the leading causes of death among women and young girls under the age of 18. And having that access to proper abortion care can help us to break that statistics and make sure less and less women, less and less girls die from this effect. And it's very important to indicate that, because we might not see the extent of it, how it's taking away the lives of girls who want to practice their right of sexual reproductive rights, but not having or living in a country where it is illegal, or not having access to safe clinics is preventing them to living a life that they choose to have. And the fact that your organization is working with clinics, so they are providing professional support, professional medical support, and I assume you're also providing mental support, because after the abortion, young girls really need that mental support, and having that someone that or organization that can support them in this time of need is very, very important. As we talked about young girls and your role, within your role, you're working with next generation of Gen Z representatives and millennial representatives. And how does the work of increasing the awareness of sexual and reproductive rights among these children look like, and what are the efforts your organization is taking into the direction?
Yeah, absolutely. So just over a year ago, Pathfinder launched our next generation engagement work, where we're focused on finding new ways that we can better engage with Gen Z and millennials. Pathfinder has such a strong international experience and depth of knowledge within the sexual and reproductive health space that there's such opportunity to share those lessons learned and generate awareness among these generations that are our future leaders and CEOs and companies, our future politicians, already creating different social movements across social platforms. So creating these opportunities for Gen Z and millennials who are really passionate about health and global health to deepen their understanding of sexual and reproductive health has been a lot of fun. We've launched our first flagship initiative for this work, which is called the Acacia Circle. And it's a tight community of really passionate next gen who want to use their voice to drive change for sexual and reproductive health. So through their membership, they really deepen their understanding of Pathfinder's work and build skills related to philanthropy and advocacy and communications, so that they're then able to serve as advocates across their networks, bring more awareness through talking with their friends or across their companies or in different ways, and really serve as ambassadors for Pathfinder. And creating those synergies and opportunities is really important for organizations like Pathfinder and across different sectors too, because we want to make sure that we're tapping into opportunities as they come for our future change makers to really feel informed and empowered about the issues that they care about, so that when they are in some decision-making position, they know exactly what needs to get done to create real and lasting change. So that's the angle our next generation engagement work is really coming from.
Mm-hmm. I really liked the phrase future generation change makers that you mentioned, because they are indeed change makers in the future, and the Gen Z is the largest group that is growing. So the number of them is incredibly high compared to previous generation, and they need to be educated on these topics, where in the future they will be future CEOs, they will be future decision makers, they will be future policy makers, and they will be future doctors who need to understand the extent of the issue of the lack of access to proper reproductive rights, and fighting for those policies, and ensuring that the laws and practices that are there to protect the rights of women and men when it comes to reproductive rights are in place and they are being enforced. And the first step is always raising awareness and educating people. And the fact that you and the whole initiative at the Pathfinder is working on building on that is very rewarding. And I applaud you and your organization for doing that.
It's a lot of fun.
Yeah, I can see. And we also touched upon the fact that your organization envisions a world where there are no new HIV infections, and you are working on stopping the spread of the HIV virus, despite every day, every hour, 1,000 women being infected with HIV virus. Could you please tell us about the work that your organization is doing in this field?
Sure. And it taps into a lot of those different areas that we've even already discussed. So, for example, we might work with pregnant mothers who are also HIV positive to make sure that they're taking their ARVs and taking the medicine that they need, also to prevent the transmission of HIV to their future child. We also, again, working with clinics, if you think about it at high level, we work with clinics to ensure that they have the services that their community needs. And included in that is also HIV services. So we're really making sure that people who are living with HIV have access to that comprehensive care that they need, and that they're able to do so also in a way that isn't necessarily exposing them to their community, because there is a lot of taboo around HIV as well. And so we make sure that, especially this is where our community health workers come in again too, is to make sure that we're able to reach these key populations in a way that really respects their privacy, and are really able to reach them in the comfort of their own homes as well. We also do promotion of testing and just general awareness raising that break down some of those myths and those taboos around HIV. So it's, again, a lot of just that education and making sure that people have the information that they need to really make sure that they're taking the medication that they need to control their HIV, but then also breaking down those barriers and those myths within communities as well, so that they're more receptive to really support each other and members of the community who need that support.
Mm-hmm. Indeed, all of these issues and all of these services fall under one umbrella of reproductive and sexual rights and health, whether it's a HIV or whether it's a safe abortion care or whether it's a contraception. And one cannot exist without another. When we are talking about the sexual health, we have to talk about the whole aspect of it and all details when it comes to it. And the fact that community health workers that you work in and the clinics that you work in are provided with necessary information and necessary tools to discuss all of these topics, as well as to provide all the support that people need, whether they are infected with HIV or whether they want to safeguard themselves in the future in order not to get HIV. So it's very, very important. If someone would like to support Pathfinder International, how can they do that?
Sure, absolutely. They can always visit pathfinder.org, where there are all kinds of details about those specific areas that we work in. They can learn more about specific projects that Pathfinder does and different initiatives that we're pursuing. And then if you want to learn more about how to get involved, there is an action center that we have where you can learn more about specific actions that you can take, where you can join our Pathfinder Next Gen community, all kinds of different ways that an individual can get involved. There are lots of events and stuff that we do throughout the year, so I highly encourage it.
Wonderful. The link to the pathfinder.org will be provided in the description. So viewing and listening can go to the website and familiarize yourself with the great work Shaylee and the team at Pathfinder International are doing. And if you would like to make a financial contribution to them, you can do that by clicking the action page in the website. Thank you so much, Shaylee. It was wonderful to get to know you and the great work Pathfinder International is doing.
Same. Thanks for the great conversation.
For you listening, if you enjoyed this conversation, please press the like and share button, because this will show the YouTube and podcast algorithm that this conversation is important, that we need to raise more awareness about sexual and reproductive rights among youth and among adults. Thank you, and see you in the next episode.